we're ready to begin our second capstone for this afternoon. Ezra Mouton will be presenting in the second capstone, and this is his thesis statement. Anterior cruciate ligament injuries remain predominantly preventable through target training and education programs focused on athlete injury prevention. Please welcome Ezra.
Imagine you're an athlete running down a field, playing the sport you love, and all of a sudden you feel a pop in your knee. You fall to the ground as you grasp your knee in pain, not knowing if you will ever be able to return to the sport you love. You are out for the season and are forced to go through surgery and rehab just to be able to walk again. As time goes on, you are finally able to return to the sport you love, but you do not feel the same as you did physically, and you constantly worry about experiencing the injury again. You cannot perform at your best, and this causes you to struggle as an athlete and as a person. You're not able to be your best, and because of this, you do not feel your best. I broke down crying after I tore it. I just didn't want to play anymore. I was alone, I was by myself. That was the first time that I really thought about my life. These are the famous words of Derrick Rose, a professional basketball player who experienced a devastating ACL injury that negatively affected him for the rest of his career. Injuries with the anterior cruciate ligament, or the ACL, have been a major problem within athletics today. These injuries, most of the time, have either ended athletes' careers or resulted in them never coming back the same. Athletes have to undergo surgery and rehabilitation post-operation in order to just be able to jog again. Some of the best athletes' careers are cut short due to ACL injuries. This injury can be detrimental to many athletes and can affect them for the rest of their lives. Surgery for the injury can also cost thousands of dollars, so preventing the injury from happening in the first place will not only prevent the athlete from undergoing the physical harms, but also the financial harms that come with ACL reconstruction. The rise in sports medicine has resulted in much research being done on ACL prevention. The issue lies in relaying the research and tools to the athletes and their coaches. If athletes can improve their overall health and prepare their bodies correctly for activity, they are less likely to experience an injury. Building a strong foundation for the body to endure the stress of action allows for the body to be better prepared for when it is in stress positions. Programs fix imbalances and strengthen the body, allowing for one's body to be more prepared for action. Anterior cruciate ligament injuries remain predominantly preventable through targeted training and education programs focused on athlete injury prevention. In order to prove this argument, I will first explain what an ACL injury is and its significance, while also listing out the dangers of the injury. Next, I will prove the efficacy of prevention and how prevention should be acted out. And then finally, I will explain what prevention looks like and how it should be implemented into athletics. First, what is an ACL injury, its significance, and the dangers of the injury? ACL injuries start with specific biomechanical failure, which usually involves a sudden change in direction, a wrong landing, or forceful knee rotation. The tibia, which is located in the shin bone, is kept stable by the ACL. The study explains the vulnerability of the ligament by detailing how the ACL stabilizes the tibia and controls knee rotation, and thus even slight movement errors may result in severe tearing. The physical consequences are just as important, causing things such as instability within the knee, inability to bear weight, loss of athletic performance, and even long-term vulnerability to osteoarthritis later in life. This medical view demonstrates that ACL injuries do not merely affect athletes for a season, but have the potential to alter the structure and function of the knee for life. While the physical consequences are great, the psychological effects of the ACL injury tend to be less considered, yet they are equally vital. A study lists anxiety, depression, fear of re-injury, and loss of athletic identity as commonly experienced by athletes after ACL tears. The uncertainty of future performance creates a self-doubt in many athletes that lowers their motivation and adherence to rehabilitation. In some cases, after physical limitations have already been surpassed, mental barriers remain an issue and may cause anxiety in returning to sport or fully trusting the repaired knee. The pain the athlete experiences also makes it hard for the athlete to fully trust the repaired knee. This pain can be excruciating for many athletes and demotivate them from prevention. This psychological toll calls for prevention programs that would not address just the physical risk factors, but also help improve mental well-being. Beyond the physical and mental impacts, ACL injuries introduce significant financial burdens for individuals, families, and healthcare systems. The College of Health Analysis notes that ACL surgeries, postoperative care, imaging, and rehabilitation collectively cost thousands of dollars, creating long-term economic consequences. The dimensions of ACL injury encompass not only physiological, but also psychological and economic elements that are all intertwined. Understanding the full scale of what athletes go through makes the need for effective injury prevention programs impossible to ignore. Next, what is the efficacy of prevention programs and how should they be acted out? Nowadays, athletics cannot function without ACL prevention programs that provide evidence-based strategies for significantly reducing the rates of these injuries in athletes. Supported by research in sports medicine that highlights modifiable risk factors and highly favorable outcomes related to neuromuscular training, strength enhancement, and the correction of movement, such as prevention programs, are securing a place in history. Neuromuscular training improves the brain-muscle connection to enhance body control, balance, agility, and movement patterns. This is effective because the better the neuromuscular system, the better the athlete will be able to control their body and decrease the chance of a biomechanical failure. The programs also strengthen the muscles, tendons, and ligaments to better prepare them for action. When immense amounts of stress is put on the ligaments, they are at risk for tearing. If the muscles are strengthened, they can receive more of the stress and relieve some of the stress off of the ligaments. If imbalances can be fixed, then the body can be more prepared for action and help the athlete in specific areas where their ligaments are at risk. Programs strengthen the hip abductors and glutes to prevent the knee from caving inward during athletic movements. They encourage a soft landing with increased knee and hip flexion, avoiding dangerous straight leg or stiff knee movements. The programs emerge from various studies not only to reduce physical injury, but also to realize significant benefits for both the athlete and the organization. With sports participation continuing to increase, the need for proven methods of prevention likewise grows, making such prevention all the more indispensable. Prevention programs in high school contributed to approximately $7.51 saved for approximately $1 spent. These are significant savings and are worth the investment for athletes. ACL rehabilitation, as previously stated, can cost thousands of dollars, whereas prevention programs can cost a significant amount less and be free for some providers. Medical research supports the effectiveness of ACL prevention strategies. A study conducted by medical physicians indicates a 51% reduction in ACL injuries for athletes who participate in structured prevention programs. This study from the American Family Physician, a respected peer-reviewed medical journal, highlights how well-rounded training, plyometric exercises, and strength routines all make a significant difference in terms of injury risk. Such evidence warrants the implementation of structured injury prevention routines in athletic programs. Simply implementing a program can cut in half all the athletes that undergo injury. For schools and sports, this is important evidence because it means that prevention programs are not theoretical, they deliver tangible and effective results. While program prevention rate has high at its baseline, research shows that ultimate necessity of a program is not by its design, but by the consistency and adherence of the athlete to the program. The empirical evidence shows that the higher adherence significantly drops the probability of ACL injuries. This, in simple terms, means that the more an athlete sticks to the prevention program, the more likely the athlete is to reap the benefits of ACL prevention. The study found that with consistent adherence, a 64% injury reduction rate occurred. The athlete must stay consistent to see the actual benefits of prevention programs. For these programs to be able to prevent athletes in the best way, athletes must adhere to program protocol and stay consistent with the programs. This dependency on consistency is further examined in research on dosage, or in other words, the amount of prevention the athlete undergoes. A study found that the higher adherence is necessary because it ensures that the training volume is met. The neuromuscular system requires a specific amount of volume when engaged, and if this volume is not met, it is not prepared, and then the program is not fully doing its job. The recommended amount is 30 minutes per week for athletes during the season of their sport and more often while out of season. These sessions will be exercises consisting of 2 to 3 sets of 10 to 15 reps or 30-second intervals. The study reported that programs are most effective when athletes do 30 minutes a week while in season and 60 to 180 minutes a week while out of season. Because the athlete is not playing the games, the main focus of the athlete out of season should be to strengthen the body for the stress. Programs are not something that should be overdone because this can put too much stress on the athlete and actually be harmful for them. When an athlete skips a session or is lazy during a drill, then the athlete won't be able to receive the full benefits of prevention programs. The nerves are not fully prepared and the body is not trying to actively prepare itself for the stressful movements. Athletes must execute program protocol contingently and with the effort the program calls for to reap the benefits of prevention. Now, what are prevention programs and how should they be implemented? Well-ordered ACL prevention programs are structured, multi-component regimens integrated into regular, consistent warm-ups and exercises aimed at fixing imbalances and strengthening the muscles. These warm-ups gradually get the ACL prepared for movement and the stress that will be put on it in future action. This includes running, sprinting, jumping, and any movement that involves a sudden stop or a change in direction. Imbalances are fixed outside of the warm-ups with things such as strength training, isometrics, and plyometrics. These imbalances are fixed by strengthening weak points in areas where the athletes are most vulnerable. If an athlete has weak hamstrings but has strong quads, these exercises would address the imbalances within the body. The main goal of these programs is to focus on balance, strength, and flexibility aimed at improving dynamic joint stability. Movements such as high knees, vertical jumps, and horizontal bounds are proven to be effective. When the ACL joint is stable, it is able to undergo the pressure put on it through jumping, sprinting, and changing direction. The authors of Exercise-Based Knee and Anterior Cruciate Ligament Injury Prevention Clinical Practice Guidelines reviews the success of various multi-component neuromuscular training. Neuromuscular training improves the mind's connection to the body. When the body has been put through repetitive tasks, it prepares the mind or the nerves to be prepared for this type of movement. For instance, if an athlete before a game goes through a pregame warm-up that includes jumping, sprinting, and changing direction, the athlete is more likely to not undergo injury because the athlete's mind and body are more prepared and connected for the stress put on them throughout the game. The effectiveness of prevention requires a program to seamlessly be integrated into athletic daily training. Specifically, studies advocate to incorporate these forms of neuromuscular programs early in youth sports to better prepare athletes for later years. If the youth can implement these types of neural pathways when they are young, then these pathways can be more well integrated into their systems, especially in developmental stages of their life. The consistent statement by National Athletic Trainer Association recommends that these programs should be necessary to ensure the best outcomes. Athletes need to implement the movement patterns when they are young so that when they grow older, the likelihood of facing these problems in older ages will decrease. Coaches, trainers, and educators are crucial to injury prevention. They must emphasize and teach correct movements, mechanics, and provide ongoing injury prevention. It is the coach's role to teach the athletes how to prevent injury, and they must serve as a model for them to learn how to prevent injury from happening. All teachers of athletics, including coaches, trainers, and educators, need to continuously teach their athletes how to prepare their bodies for action. This is not just telling the athlete to touch their toes before sprinting or doing a couple jumping jacks before a baseball game. Coaches must implement neuromuscular training, strength training, and focus on mind-body connection. Coaches of athletics must engage with their athletes and help them to better prepare their bodies for games. This helps the coaches to better understand their students and helps the students to better understand their bodies. ACL injuries can be devastating and result in many physical, mental, and financial burdens. Prevention programs prove to be effective for preventing injury, but also for saving families money. Adherence is most important because it ensures that the starting volume is met and helps the athlete's body to be better prepared for action. Many of the injuries happen because of improper warm-ups before activities or lack of athlete adherence. The coaching staff prevent injuries by implementing proper prevention programs and targeted training for athletes to decrease injury. Coaches are the people who aid athletes in an athletic journey, so in order for everyone to reap the benefits of prevention, coaches must help athletes with injury prevention. The health of the athlete is the most important thing and will help our athletes thrive and better prevent injury within the future of our athletics. Thank you.
Well,
begin with faculty questions, please.
Mr. Hanson?
Thank you for your presentation. I'm wondering about things like Tai Chi, ballet, and Pilates that I've heard stories of NFL players being directed toward, as a training tool or technique. And I'm curious if there's something about, do we just not think about slow, mindful movements enough, I guess, in sports training? I wonder if you could, what is your sense from what you've learned in your capstone about, the way we train, or is there something about those types of techniques that we fail to recognize as important?
Specifically with those type of training ways, like the Pilates and all those things, they focus on flexibility and putting the body in positions that it hasn't been before. So many of the NFL players and professional athletes do this type of training because they put their bodies in positions that they haven't been before. So when they are doing athletic movements and things like that, and there's like a failure within their body, then their body knows how to react to that and has been put in that position before. And so that's why many of athletes, professional athletes, do that type of training.
Thank you.
Ms. Wassau?
Thank you for your presentation, Ezra. A large part of training the body, the muscles to do what you want them to do is recovery. Can you speak to your research as to what it may be referred to as like those younger bodies who maybe have not gotten that level of strength training in, to their injury, the increase, like let's say they're playing travel ball year round, they're also playing rec ball during the summer, they're also playing for their school and whatnot. So they might be playing year round with those muscles and they might not be training them as much. Did you see in your research that maybe that may be supporting the rise in ACL injuries?
I didn't do too much research on that, but I can answer that recovery is important, and many athletes don't get enough recovery because they're playing sports year round. And so this can be a cause of many ACL injuries and just injuries in general because they're not getting the proper recovery for their muscles to recover. And so their muscles can't take the load of their athletic movements and putting a lot of stress on their ligaments. And so recovery is important to strengthen the muscles because if they don't recover, then their muscles can't be strengthened.
And just to follow up real quick, should that also be incorporated into the education program that you were speaking about?
Yes, that should be recovery. It should be or they should teach athletes that recovery is important because if they're not recovering, then their muscles they're not strengthening to their full capabilities. So yes, the education program should incorporate that.
Okay, thank you.
Mr. Gray?
Thank you, Ezra. I think you started to mention this at the beginning of your presentation. And I was wondering about the role of specifically physical education, so PE classes in school for younger students and then for older high school students. What do you think the role of those classes is in helping to teach students about this particular issue?
I think a main thing that those physical or PE should teach is to warm-ups and things. A lot of PE classes do incorporate that, but that should be like a repeated thing that they relate to their students. Like consistent warm-ups is very important for athletes before games and just activities in general. So I think making warm-ups like a main thing, like preparing their body for action, should be something that teachers should incorporate in their education.
Thank you. And then one follow-up question. In terms of athletes who tend to want to skip warm-ups and show up right before game time, what do you think is the role of coaches in helping athletes to understand that part of the warm-up is super important?
I think the role of the teachers is to just really make it an important thing that the warm-ups are important, and just looking at other examples of athletes who have occurred, like injuries occur with them, showing them those examples and making them see the injuries and knowing that they could experience these injuries if they don't warm up correctly. And so making it known to them that injuries can occur and are more likely to occur without proper warm-ups, that's what teachers should do to better help them with adherence and things like that.
So teachers and coaches should have examples or stories to share that highlight the risk.
Yes, sir.
Thank you.
Mr. Cortez?
Thanks, Ezra. It seems like statistically that recently female athletes are more prone to ACL injuries than male athletes. So I'm just wondering if in your research you encountered anything different about suggestions for prevention for female athletes as opposed to male athletes.
I didn't do too much research on that specifically, but I can say that female athletes have weaker muscles, and therefore when they're put in stressful positions, their muscles can't take the stress off of their ligaments. And so strengthening the muscles is very important for female athletes. So that should be the main thing of their prevention, but also neuromuscular training. But that should be the main thing with female athletes.
Thank you.
Ms. Lees?
Thank you for your presentation, Ezra. I was interested in the psychological effects of something like an ACL tear that you mentioned in your presentation, and I'm wondering if you can elaborate on maybe the psychological benefits of participating in a sport, even as on the student level, not just the professional level, and perhaps the psychological detriments of being out for a season because of something like an ACL tear.
First, in the psychological benefit, can you say your question?
Yes, can you share some of the psychological benefits of participating in a sport?
So the psychological benefits of participating in a sport could be things such as discipline, and mainly discipline, because you have to listen to somebody and repeat tasks, maybe sometimes that you don't want to do. And getting better at a sport, you need to be disciplined to get better, because you're not going to always want to play, and it takes time. And so that could be one of the benefits, and that's probably the main benefit, just discipline.
Thank you.
Ms. Pagan?
Ezra, thank you. It seems like these injury prevention programs are highly efficacious both on a financial standpoint and psychologically. I'm wondering if in your research you found any counter arguments to yours. In other words, why wouldn't athletic communities implement injury prevention programs like the one you're advocating for?
What I found mainly was that it takes the coaches have to learn how to properly do this, and so that takes time and also money. And so the coaches learning that would be hard for them to, especially if they have a lot of athletes. So that was the main thing that I found, or a counter argument that I found with my thesis.
Do you find that the benefits of these injury prevention programs override those issues that you're speaking about in terms of the financial burden as well as the burden on the coaches?
Yes, ma'am. I found that prevention programs, while they are hard to learn, they still override the training, because if athletes can experience injury less, then the athletes are able to play on the team, and if the athletes are able to play on the team, the performance of the team is able to be better. So that's the main thing that I found.
Thanks, Ezra.
What senior questions do we have?
Jacques.
Thanks, Ezra. I was just curious, are ACL tears like concussions in the sense that once you get one, it's way easier to get another one?
Yes, sometimes it can be easier to get another one if the athlete doesn't have proper rehab. But if the athlete is proper rehabilitated and they like repair their knee and fully recover it, then it's not as likely for the injury to happen.
Thank you.
Thank you, Ezra.